Hi, this is Tom at the University of Iowa. I'm going to show you a Rhexis that I recently did on our EyeSi simulator for eye surgery, which is from VR Magic. You can see that we're getting our focus just right, getting our view just right with magnification changes, which have a foot pedal very similar to that of a Zeiss microscope. Here the forcep is coming in, and you can see that we've got a tear that's already begun and a black line, which will be our guide as we make this Rhexis. I've been able to grab the initial tear and I'm trying to bring it around so it just follows the black line of the Rhexis guide. Redirecting the flap is relatively straightforward and very similar to that of a real Rhexis, although the tissue characteristics are slightly different. You can see that centration is an important part of this, and I'm having a little trouble keeping it centered, but I'm doing a reasonably good job. In that case, I grabbed underneath the flap instead of on top of the flap as I intended, but the tear is going fairly well. Right here, I'm getting into the cornea. I just rubbed against the cornea a little bit. You can see it whitening there, and I'm getting some points counted against me for that. At the conclusion of this simulation, the device will give you a score which tells you how well you stayed centered, how well you stayed along the line, and how much you touched the cornea, among other factors. I did fairly well on this, about an 89 or so out of 100. This is Tom at the University of Iowa. Thank you very much.